if a person goes undiagnosed, we've talked a little bit about, osteoporosis, we've talked about, mast cell leukemia. If a person goes undiagnosed and untreated, do they eventually hit, a proverbial brick wall, landing at one of those two buckets? What is the result of being unidentified and untreated when it comes to systemic mastocytosis?
Well, besides, clearly some really debilitating conditions, hopefully that they will be recognized and they will be treated. But, I mean, I'm sure that I've met patients who've been debilitated for many, many years and people didn't know what was wrong with them until somebody figured it out. Hopefully there's nothing really, really horrible, such as, an anaphylaxis with, bad outcome or something like that. But hopefully if the patients are thinking that they have this and, hopefully your podcast will reach out to patients, to physicians, to other people to recognize, hey, this could be me. They will get treated. And people can live for many, many years exactly with this, just like any other chronic condition, just like having, hypertension, diabetes, and a lot of other chronic conditions. People can live with many years and suffer and not really know. And so it doesn't necessarily mean it progresses onto anything else. It could just be systemic mastocytosis for a long time. Yeah, it doesn't really resolve per se.
And Jessica, as well, do either of you find that, let's say, patients are being given antihistamines, for instance, is there a chance that patients develop a resistance to these treatments over time? Are there any long-term side effects, resistance, or anything that you've seen when someone kind of lives with treatment over these long periods of time?
I haven't seen that per se. I will say that sometimes, like, this is completely anecdotal. I am not a physician or scientist. Sometimes patients will just say, like, I used to use Claritin as my or Allegra as my antihistamine, and now I'm switching to Zyrtec because I just am not finding that's not working quite as well. But I don't really hear patients saying that, like, the treatment just stops working altogether. Um, the new treatments that are out, they've only been approved for a few years. They're still in their long-term clinical trials, if I'm not mistaken, just to see what the long-term aspects will be. But they, have been deemed safe, and we don't expect there to be, any long-term things there. Um, I will say that, like, and Dr. Siri, I think you should speak to this more than I, but I'm certainly hearing from some of my allergist partners that, like, they are trying to limit the use of first generation antihistamines. And that message has been kind of taken a long time to get down to the patient level. Like, we're trying to help with that. But just because those first generation histamines can cause more side effects. But Dr. Siri, I don't know if you want to speak to that at all.
Yes, that's such a good question. I think people are concerned, especially if they're self-treating, because so many patients, of course, self-treat. They just self-treat. They just, we've had patients come to us and they're like, oh, I'm taking this over-the-counter medication like 10 times a day. And we're like, what? So, well, that's the only thing that helped. Like, I know, but, you should have come to the doctor first. And so I get that. There are a lot of great medications over the counter. I mean, technically speaking, pharmacologically, you're not supposed to have what we call tachyphylaxis, which means that you take a medication and then, like, a month, a year later, like, you need more of it because it's dulled you. Technically, pharmacologically speaking, that's not supposed to happen to antihistamines, but you and I, Jessica, Esther, we all know that this is what we feel. We're like, wait a minute, this is part of what we understand with antihistamines in general, is that you need more and more of it. But, it's hard to know what the truth is. Is it because, your symptoms kind of wax and wane? Is it because your symptoms gotten worse and you just need more antihistamines? Or is it really that you've had the dull effect? So, we can argue with a pharmacologist all day long if we want. But in any case, we do notice that some of those antihistamines, those first generation antihistamines and second generation antihistamines, yes, it seems like sometimes we need more. And it seems like sometimes they aren't as effective and then we need to switch. Absolutely. And there is a leaning against a first generation antihistamines because of its untoward side effects, such as potential to cause sedation. Even though people say, oh, yeah, it activates me. I have different symptoms. It doesn't make me sedated at all. Still, if you take large clinical studies, it actually does slow you down, especially in children. It can basically decrease, your ability to react and those kind of things. And so typically if somebody's on higher doses of antihistamines, we really don't want them operating heavy machinery or really driving and those kind of things. So most of us have leaned away against using that routinely or even daily. We feel like it's best to basically use them periodically for episodes of problems, but not necessarily every single day. There's, second generation antihistamines, which are considered less sedating or non-sedating, which we have leaned on, and we know that they have been safe even at higher doses, maybe not 8 times the dose. At least in the United States of America, we considered even 4 times the dose of the over-the-counter dose as safe, and we can layer on multiple ones. And of course, besides those types of first generation and second generation H1 blockers, we also add in histamine 2 blockers, which we often know as those medications to treat the stomach. Things such as cimetidine or things such as ranitidine, those things over the counter that we typically use for acid reflux, because a lot of those histamine 2 receptors are in the stomach, but they happen to be in other places too, including the skin. So that's helpful to us. And then, of course, medications now we're transitioning to things that are not over the counter, but things such as leukotriene blockers, mast cell stabilizers, and then ultimately for patients with systemic mastocytosis, these are basically kinase inhibitors. I know that's complicated to talk about with lay people, but what that means is that it interrupts that activation signal so that the mast cell doesn't reproduce. So really, those are the most profound effects in terms of reducing those thousands, if not millions, of mast cells that are producing to much, much lower quantities so that at least they don't have as many chemical burden in their bodies. So that's been a really great boon. And yes, so currently the medication, there's only one medication currently approved for systemic mastocytosis. On that one, they use in much lower doses than they would use for advanced or mast cell leukemia, advanced mastocytosis. And so because the dose is so small, it's been very safe and very well tolerated, and has not been associated with a lot of side effects that you might see at much, much higher doses to treat advanced systemic mastocytosis. And then you had spoken about, and then Jessica talked about these symptoms. Like, how do we track the symptoms? This specific company that made this drug has created their own symptom evaluation, where people are layering and looking at the different diagnostic criteria, such as bone pain, or such as gastrointestinal issues, or such as hives or flushing. And then we can track it on that kind of survey over time to see how the patients are doing. But certainly you can use any methodology to track your patients, whether it's depression scales, whether it's urticaria scale. But that one is specific to that medication, the disease process. It is proprietary to them, but it is helpful, at least in my practice, when I'm looking at patients, because I use that information from the clinical trial to track patients over time when they're on that medication. So that has been helpful for me, and patients like to track themselves as well.
And for patients who might be listening, I do recommend, of course, I have to recommend the Mast Cell Disease Society's website, tmsforacure.org. We have printable patient guides. We have Google Sheet symptom trackers. We have just lots and lots of resources. Food reintroduction guides if you've had to limit your food and you need to reintroduce. So there's a lot of resources there that can help patients sort of keep track of this, make sense of this, and then they can take those things to their doctor.